All right, good afternoon and welcome. Thanks for joining us for this COVID-19 press briefing. We certainly appreciate you being with us today. Today, Mayor Demings will discuss our COVID cases, positivity rates, and sadly, the number of those who are deceased due to this pandemic. The mayor will offer some good news on where we have been as it relates to the pandemic and where we are now. He will discuss our vaccinations, testing locations, and we'll have details on rental and mortgage assistance. As you can see, Comptroller Phil Diamond is here and will report on tourist development tax collections for the month of January. We will begin with Mayor Demings. Mayor?
All right, good afternoon to all of you. Thank you for being here today. Again, this is the 172nd news conference since the pandemic began, and the first that we've had since February the 2nd, so it's been nearly a month at this point. As we move forward, I do want to recognize some of the issues that have been impacting us across the globe, one of which obviously is the Ukrainian crisis. And like most Americans, I find the actions taken by the Russian forces to be reprehensible. And we stand with the Ukrainians and their government. I would tell you that I have been asked what is Orange County's position about some of the economic sanctions that have been recommended. That is largely something that has been left up to the federal and the state government in that regard, but I will tell you that Orange County does not have any direct investments in the Russian companies or corporations. And so we'll leave it at that. So our hearts and prayers do go out to the families of the Ukrainians who have been impacted most directly by the war at this time. If you're like me, those are horrific images that we have seen on television, and you gotta say that your heart goes out to those families who are suffering. You know, we've seen the gallant efforts of the mothers with their small children. So none of us would want our families to go through that. And so because of that, from an Orange County government perspective, we do understand and support the Ukrainians in that regard. So with that, I'm going to move forward and talk about the issues kind of closer to home today, and that's the novel coronavirus and where we stand today. You will notice that we do not have a representative from the Florida Department of Health in Orange County at this point. They've chosen not to participate in the press conference. But I do want to take time to go over the numbers today. As many of you remember, the Omicron variant arrived in our community at the end of last year. By January the 10th of this year, we saw our highest 14-day rolling positivity rate at that time, which was 40.81%. Today, we are back in single digits, 6.4%, which is nearing the 5% infection rate that we have been told by epidemiologists in the past is a good indicator that the infection is under control. Additionally, on January the 6th, our utilities division, who has been tracking COVID-19 in our wastewater systems for months now, they saw the highest number of gene copies reported, which was a record 18.8 million per liter. That same service area is now reporting just under 55,000 gene copies per liter. So down from 18.8 million to 55,000. That is a 99.7% decrease in just 2 months. Ed Torres, our utilities managers here. In regards to the hospitals, we are continually in conversations with our hospital systems, and they are telling us that they are seeing similar declines Advent Health shared with us that their hospitals across Central Florida saw its largest amount of COVID-19 patients back on August the 23rd, 2021. At the time, they were providing care to some 1,600 patients. Today, they have 160 patients at their hospitals, so, but 10% of where they were back in August of last year. Our Orlando Health hospitals in Orange County today are reporting 63 patients with COVID-19. As of yesterday, at the height of the Omicron surge, they provided healthcare services to 390 people on January the 10th. Nemours Children's Hospital reported that they are currently providing health care to only 2 pediatric patients involved with COVID-19. That's substantial decreases in our community. And here within our Orange County government family, the trends indicate the same. I'm happy to report that after having 327 employees out with COVID-19 early in January of this year, we currently have only 13 members out on sick time and healing from COVID-19. We have also seen more and more people choosing to protect themselves and get vaccinated. 76% of Orange County residents ages 5 and older have had 1 or more shots of the vaccine. Now let me just kind of share with you the numbers. As of today, there are a total of 382,130 coronavirus cases reported in Orange County. The number of Orange County residents who have passed from COVID-19 since the beginning of the pandemic is a staggering 2,689. So nearly 2,700 have died of COVID-19 in our community. Our 14-day positivity rate, again, is now 6.4%, which is down significantly from our last press briefing on February the 2nd. At that time, our 14-day positivity rate was 25.8%. That's 19 points down in this last month, which is great news for our community. The percentage of residents ages 5 and older who have had 1 or more shots of the vaccine stands at 76%. All of these indicators tell me that we are in a much better place today than at the beginning of this year. Since the spike in Omicron cases, we have mandated that Orange County employees wear masks while at work. With the dramatic decline in cases and current data, at this time, I'm making the announcement that we want to be cautious, but we will be relaxing our mask mandate for employees inside our facilities. This will exclude our correctional and healthcare facilities and the staff members assigned. I'm also encouraging those employees who believe it necessary to wear facial coverings to do so at their discretion. Now, as it relates to testing, we want our public to know that Orange County is remaining committed to providing free testing and vaccinations to our residents. Orange County's 3 free COVID-19 testing sites at Barnett Park, Econ Soccer Complex, and the South Orange Youth Sports Complexes remain open. Orange County's 3 sites will continue to also offer testing between the hours of 9 a.m. and 5 p.m. daily. For more information, you can go to our website at ocfl.net/testing. Barnett Park remains the only Orange County-run site for vaccinations. Anyone 18 or older can get the vaccine between the hours, again, of 9 a.m. and 5 p.m., 7 days a week. On the weekends, we also offer the vaccine for children, which is available by appointment for children between the ages of 5 to 11. A legal guardian must be present. If you cannot get to Barnett Park, there are many other locations for eligible individuals to receive COVID-19 vaccine in Orange County. To find a vaccination site near you, you can simply go to our website at ocfl.net/vaccine sites, or you can go to vaccines.gov. We continue to offer rental assistance. Many of our residents are still chronically rent stressed, and they need assistance. The programs remain open, and we are still taking applications. Eligible applicants can receive up to 12 months of assistance with past due rent and up to 3 months of future rent payments, totaling no more than $30,000 in emergency assistance. I'm happy to say that Orange County has approved, at this point, over $20 million to help keep families in their homes. To date, Orange County staff has assisted over 3,400 such families who were qualified for the rental assistance and thereby avoiding eviction. If you want information about the rental assistance program, you can go to ocfl.net/rental assistance. Some individuals ask the question, what about those of us who have mortgages? The state's Homeowner Assistance Fund is now registering homeowners for mortgage relief. Available options for relief include mortgage payments, utilities, homeowners insurance, property taxes, fees, and other related costs. Homeowners can complete the first step of the process by going to floridajobs.org/HAF. And now, with that, I'm going to turn it over to Orange County Comptroller Phil Diamond to present the January Tourist Development Tax receipts.
Thank you, Mayor, and good afternoon, everybody. Before I get into the January TDT receipts, I wanted to echo the Mayor as far as my support for President Zelensky and the people of the Ukraine. I forget who it was that called Russia the evil empire, but that description seems especially accurate right now. Moving on to January tourist tax receipts. The tourist tax receipts for January were $22,414,000. That is a 189% increase over January of last year. It was lower than December collections by $5.8 million and lower than January 2020 collections by $3.6 million. By way of comparison, those were the lowest pre-pandemic January collections since January of 2017. The chart behind me shows you visually what happened. The January numbers, for ease of reference, are highlighted in yellow and black, and that'll show you the story of the last 4 years, and it shows you the story of the last 4 Januaries. On the reserve side, there was an increase of about $492,000 in our reserve account. And I'll remind you that there's about a 2-month lag between the time that tourism taxes are collected and the time they're reflected in our reserve numbers. And these reflect the collections from November. On a cumulative basis, since the start of the pandemic, the county has used about $129.5 million to meet its TDT obligations. And that's caused our undesignated reserves to drop from $181 million to $51 million. And then finally, we will release the February TDT collections in early April. So with that, I'll be glad to take any questions during the question and answer period. Thank you.
So that's good news. Relatively speaking, those are good numbers for our tourist development tax receipts, which kind of indicates our economy is doing fairly well, even in the midst of this pandemic. We'll open it up for any questions. If there are questions for any Spanish-speaking media that need to be translated, we do have Ms. Ilia Torres over there who's joined us, and if necessary, we also have Dr. Yolanda Martinez from our Health Services Department who has joined us also. With that, we'll open it up for any questions.
Thank you, Mr. Mayor. Steve Jack from the Orlando Sentinel. I'm curious, you said that the health department has chosen not to participate. They were invited, I assume, then. Did they give a reason for not wanting to participate?
No, I'm not aware of a reason that was given.
Are they still, I'm sorry, I know I'm breaking the rules. Are you still able to partner with them at all on healthy issues?
We have an executive policy group call where they do participate on that call, and they provide information and data during that period of time. But without the presence of Dr. Pino, there has been a missing link there. There's no getting around that. The staff that remains there, you know, there's a person that is temporarily heading up the office, and we try to communicate with them as much as possible, but there is no question that there has been a deficit of communications with the absence of a permanent lead or director.
Troy Campbell with Channel 6. Mayor Demings, yesterday the governor told a group of high school kids that they were, quote, ridiculous for wearing a facial covering. A spokesperson in his office told me later that night that the public's sick of being lied to and that facial coverings don't have a benefit. What is your stance still on facial coverings, and what roadblock, if any, when you have other people involved in policymaking having opposing views?
Only thing I can tell you, every bona fide physician or epidemiologist or infectious disease expert that I have talked to have all confirmed that the wearing of facial coverings provided some protection from the spread of COVID-19. So to me, I saw the governor's statement. I think it is somewhat contradictory when he says we're a free state. Well, I think those young people were free to wear their facial coverings, and in some ways that's an expression of your First Amendment rights. And so if you're free in one way, you should be free in other ways when you assert the Constitution of the United States as the basis for your decisions or your comments. And so that was a sad day, I think, for those students. It had the appearance that the governor was frustrated for whatever reason. He's the one that called the press conference, and those young people made a decision to wear facial coverings. And then it kind of had a feel to me like, you know, he was upset that they came to his press conference wearing a facial covering, and then he just kind of basically bullied them, the few who removed the coverings. Didn't look right to me. If I was a parent, if that was one of my children, I would have been upset about it. So I'm sure it's up to those children to formulate their opinion about what happened there, and everybody else who watched it. We all have an opinion, but I just expressed mine to you. I think it was contradictory.
Okay. Una pregunta en español, por favor. Spanish question. Mayor, aquí.
Oh, there you go. Where is he?
No problem. Ok, bueno, en español, por favor, para Telemundo 31. ¿Qué pasó con el doctor Pino? por favor, nos podría responder esto. Y lo segundo, también su reacción en torno a lo ocurrido ayer con el gobernador Ron DeSantis, cierto regaño ahí con unos estudiantes de un colegio. Por favor, Mayor.
So the question from Telemundo, what happened with Dr. Pino, if there's an update that you can provide, and your reaction as to what happened, the incident yesterday with Governor Ron DeSantis and the students.
I have been in communications with Dr. Pino on several occasions recently.
He estado en comunicación con el Dr. Pino en varias ocasiones recientemente.
Overall, Dr. Pino is doing well.
En general, el Dr. Pino se encuentra bien.
However, I think he's still in this status where he has been relieved of his duties and responsibilities.
Aún así, entiendo que él aún está en su estatus de relevo de responsabilidades y para con su trabajo.
I believe that he feels that not knowing his final fate with his employer is worrisome to him.
No saber la decisión final que tomará su patrono ciertamente es de preocupación.
But he seems to be in fairly good spirits and beginning to come to the realization that he may be forced to be in a position to look at other employment options.
Está de buen ánimo y obviamente pues está considerando o se ha visto forzado en considerar quizás otras opciones de empleo.
Dr. Pino came to be well respected by his peers in healthcare.
Dr. Pino se convirtió en una figura respetada por personas de la salud y por sus otros colegas.
Well respected by the business community here.
Respetado por la comunidad empresarial.
And well respected by the average Orange County resident.
Y así también respetado por los ciudadanos.
Earlier today, I had a meeting with some executives from the hotel and lodging industry.
Esta mañana tuve una reunión con ejecutivos de la industria hotelera.
And they complimented Dr. Pino on his assistance in the economic recovery efforts.
En la reunión en la cual aplaudieron la labor del Dr. Pino con relación a la reactivación económica.
So I don't know what are the remaining issues internal to the Florida Department of Health and Dr. Pino's employment.
No me consta cuáles son los problemas que permanecen con relación al Dr. Pino y su relación de empleo.
We simply wish the best for Dr. Pino.
Le deseamos lo mejor al Dr. Pino.
I certainly relied on his advice over the many months, and I believe that it was very credible advice.
Yo personalmente me apoyé en el consejo del Dr. Pino y obviamente aprecio su aportación.
So there's no question I'm a supporter of Dr. Raul Pino.
No hay cuestionamiento de que apoyo al Dr. Pino.
Okay. And the second question,
are your words words of departure or farewell for Dr. Pino?
I can't offer that. Dr. Pino may very well come back to work. They're within the Florida Department of Health, and if that happens, I'll be elated for him if he continues his employment.
No puedo decir que son palabras de despedida, pero ciertamente el Dr. Pino muy bien pudiera regresar a su trabajo, ser reinstalado y estaría muy contento de que así sea.
I don't know, his fate in terms of his employment with the state.
No sé cuál será el resultado de su empleo con el Estado.
Okay, the second question. I heard Governor DeSantis, but what was it in reference?
In reference, your reaction to the incident with the kids at a school setting regarding masks?
Again, I was disappointed in the reaction that Governor DeSantis made in responding to the youth.
Ciertamente el alcalde se sintió decepcionado por la reacción del gobernador para con la juventud, con los jóvenes.
I didn't think that it was necessary.
Entiendo que no fue necesaria.
If we are a free state as it relates to the wearing of masks or getting vaccinated, then it should apply in all circumstances.
Si tenemos la libertad de utilizar la máscara o recibir las vacunas, entonces también debe ser de libre selección utilizar la mascarilla.
Any policies of the state or any of that.
Los estudiantes ciertamente no están en violación de ninguna ley o ninguna política del Estado o nada que se le parezca.
Okay. All right. Other questions?
Good afternoon. Gail Pascal Brown, West 2 News. This is more of a question, I guess, for the schools with Scott.
Scott Howard.
Any new reports as it relates to our kids, mask wearing? How are they faring? Do we know as far as what OCPS school children are facing right now and how they are doing?
Thank you, Gail. Good. I mean, our dashboard data as far as our case positivity rate, 98 cases in the last 7 days. That's out of 206,000 students, 25,000 employees total. So doing well. Our students have transitioned back. We were concerned about many of them staying home as a result of Omicron in January, but have transitioned back and are back in school face-to-face. A week from today, students will leave for spring break. And so we certainly want to caution our families as they go on to spring break to make sure that they are taking precautions still, because we will be coming back to school after spring break, and we want to continue on this trend and make sure that we do have a smooth ending of the school year and of the last 9 weeks. And so we're certainly encouraged by the data and what we're seeing. We know that we just lifted our adult mask mandate on our campuses, and so, but many of our students are still choosing to wear masks, and parents are wanting to do so, and they're welcome to do that, and our adults as well. And so we just want anyone to who feels like they need to do that in order to protect themselves or their family to continue to do it. And we'll support that. But we just want everyone to have a great last week of school here between now and spring break, and have a great spring break, come back well rested and ready to finish out the 9 weeks. Thanks, Gail.
There was one question text in for you, Mayor Demings, from Ryan Lynch in the Orlando Business Journal. His question reads, Mayor Demings, how would the county handle any potential future surge of COVID should the numbers tick up again?
We would go back and look at the emergent circumstances and take action. You know, we would take action to try to isolate it, contain it. We'd evaluate the circumstances, and then we report back to our community, as we have done throughout the pandemic. All right, with that, let me just say thank you to all of you for being here today. I know a lot of news is happening in our community today. Thank you. We thought it was important to give our residents an update.